This is placing a urinary catheter on a male dog. I have my supplies set up right here. I have the sterile gloves that I'll be wearing. I have the 8 French red rubber catheter that we'll be doing a simulation of placing. I have chlorhexidine scrub here. I have the sterile lubricant. I have the syringe with the needle for collecting the sample, and then the needle will be placed on the syringe so that I can put the urine into this urine collection tube once it's collected. And I have the sterile lube. So that's all my supplies. And so what I can do is I can go ahead and open up my gloves. And then I can place some sterile lube on here. And then I'll put my sterile syringe on here. And now that that's all placed there, I can measure the catheter or estimate a measurement. So what I can do is palpate for the bladder, where the bladder is. And once I have that felt, I can start at the penis and work my way up and back. Sorry, let me put this down. Up and back to where it hit the bladder. Follow the line of the urethra, which goes around this way here, up into the bladder. So it looks like we'll be using pretty much the whole tube here, the whole red rubber catheter. Just about. Okay. So now that I've estimated the catheter, I can go ahead and put my gloves on using the open gloving technique. And now that my gloves are on, I'm not going to touch anything that's unsterile. So she's going to go ahead and open up the catheter for me sterilely. I'm just going to hold this in this hand, and then she can bring the prepuce back so I can scrub the tip of the penis. So I will grab the top scrub here without the one that's touching the tray, and then when she has that out, I can scrub it with the Chlorhex without touching anything unsterile. Okay, and at this point, this is the simulation part. I would lubricate the catheter with the sterile lube, and this is the part where I would pass it through the penis and then carefully feed it through without using any excessive force, because we don't want to cause any trauma to the patient. I would feed it through until where my measurement is, and then when I get to my estimated measurement point, I would take my syringe and attach it to the catheter. I would withdraw my sample, and then with my sample withdrawn, I can go ahead and pull the catheter slowly back out. And at this point, I can put the needle back on, let it draw out my sample, and then I will put the patient's name and the date on here. And then I will put this immediately in the fridge to be sent out to the lab. And that's it. Hi, this is Lisa, and this is a continuation discussion of the urinary catheterization videos. I just want to elaborate a little bit on the importance of sterility and being careful when placing the urinary catheters. When you're placing the urinary catheter, you want to be able to not cause any kind of trauma to the patient. So one of the things that's very important is lubricating the catheter before passing it. That way it could glide smoother and you're not creating a rough transition for the catheter inside the urethra. If you don't, it could cause trauma to the urethra or to the bladder wall that can cause more problems for the patient. Another thing is when you're passing the catheter, you want to do so very, very gently and to not force it, because there could be some kind of obstruction. There could be like a narrow passageway. Or whatnot. And you could, if you force it and not go gently, you could create some kind of perforation inside the urethra or the bladder. So that's another good reason why you want to measure the catheter as well before placing it, because if you keep feeding it and feeding it and feeding it, you could perforate the bladder walls as well, so and cause urine to leak out into the abdomen. So that's why it's really very important to be very careful when you are placing the catheter, as far as being gentle, measuring it, and lubricating it properly. The other point to make when you're placing a urinary catheter is to make everything completely sterile. You're going to wear your sterile gloves. You're going to use a sterile catheter. And then after you're all gloved up, you're not going to touch anything that's unsterile. You're not going to reach over for anything, any other equipment. You're not going to brush your hand up against anything. You're not going to put your hair back. You're not going to reach for your phone. You're not going to pick your nose. You're not going to do anything. And then sometimes people do things without thinking of it. Just automatically they'll go to scratch their nose or brush their hair back or brush up against something. You need to be very aware at all times where your sterile field is and where your hands are at all times. So one thing I like to do, especially if I'm in surgery or placing a catheter, is I like to keep my hands like I'm praying right in front of me. So I clasp my two hands together. When you're placing a urinary catheter, you can't really do that, but I do still like to keep my hands up in front of me with the catheter. That way that I'm not brushing up against anything, and there's less chances of me touching something that's unsterile, because if you do touch something that's unsterile, you're introducing potentially pathogenic microorganisms to the patient that wasn't there in the first place, causing even further complications as far as urinary tract infections and whatnot. Because when you're in a veterinary hospital, as much as we clean, it's like 99% of the job is cleaning. It's very unsterile around the patient, as far as, the sink that you could be working on or the exam table that you're working on has had like anal glands, vomiting, diarrhea, fungus, parasites, just all kinds of things that it's exposed to, and we don't want to introduce any of that to the patient. So that's why it's of utmost importance, after you're gloved in and you're all sterile, you don't touch anything sterile, nothing at all. So just be aware of that, and be aware of your sterile field at all times.